Hello, my name is Gloria Agosto Davis, and I'm the Program Manager for Ending the HIV Epidemic at the Cuyahoga County Board of Health. Today, I'm going to be going over some key features of the Ending the HIV Epidemic strategies. As you all may be aware, there are four pillars that are integral to the EHE project: diagnose, treat, prevent, and respond. And so we want to diagnose people who have HIV as early as possible. We want to treat them, get them into care. We want to prevent any future transmission by utilizing PrEP, syringe services programs, condom usage. And then, of course, we want to respond to any potential outbreaks that may occur in our jurisdiction. So just to provide some national context, EHE is a nationwide initiative, and in the state of Ohio, we have three distinct areas that are focusing on EHE prevention and care efforts. Of course, Cuyahoga County being one of them, also Franklin County and Hamilton County as well. There are two main dashboards that really support and track the efforts of the EHE initiative, one of them being the AHEAD dashboard and the other being Ready, Set, PrEP. The AHEAD dashboard looks at 6 key indicators of tracking the EHE project. Number 1 being incidence. Number 2 being diagnosis. So we want to ensure that people who may be unaware of their status are being diagnosed as soon as possible, so that they know, whether or not they're HIV positive or negative. If they're HIV negative, we want to get them on PrEP if they're interested. We want to link them to medical care, and hopefully once you link someone to medical care, they will eventually lead to viral suppression. And this is a very important part of ending the HIV epidemic, because when someone is virally suppressed, they're unable to transmit HIV to another sexual partner. The way this is referred to is U equals U. So U, undetectable, equals untransmittable. And this is a very key component and lesson that we're trying to kind of put out there, because not a lot of people are aware of that. We're hoping by utilizing all these strategies in Cuyahoga County that we'll have the ability to hopefully reduce new transmission by 75% in a 5-year period, and then by 90% by 2030. So we're on our first 5-year cycle of this initiative, but it will be happening in Cuyahoga County for a 10-year period. In Cuyahoga County, we utilized community feedback to really outline what our EHE strategies will look like. And what the community told us is that, hey, these 4 pillars are great, but there are other kind of overarching strategies that we should be mindful of if we're really going to end the HIV epidemic. So number 1 being reducing systemic racism. Number 2, LGBT inclusivity and care. Number 3, prioritizing populations who are disproportionately share the burden of HIV transmission in our county. Social impact media, so really utilizing social media, Facebook, Instagram, Snapchat as a way to reach the public and educate the public. Health education itself, so educating young people, so they understand how HIV can be prevented. Workforce development, which really focuses on our care providers, ensuring, like what we're doing today, learning about HIV, ensuring that we're, treating people adequately and appropriately and quickly. Another overarching strategy is modernization of HIV laws. We know and understand that the current laws on the books in the state of Ohio can really add a lot of stigma to even obtaining an HIV diagnosis. So it can be a very important part to whether or not we're going to be able to actually end the HIV epidemic in that 10-year period. And then, of course, tracking all of our efforts. So looking at data and ensuring that we have the proper infrastructure that can really support us tracking this over time, with the AHEAD dashboard being one of those important data infrastructures. So here locally, I'm going to speak to a couple examples of the EHE projects that are occurring in Cuyahoga County. So one of them is Data to Care. So this is a collaboration with the state of Ohio, the Ohio Department of Health, where we are looking and we are trying to get the people who have not been into care back into care. So this is done by data sharing between the local jurisdictions and the state of Ohio, so that we know people who have not recently had a viral load screening in their health care system. We also are doing intensive medical case management, and this differs from traditional case management in that these are clients who may have either drug, alcohol histories, or mental health challenges, which make it very difficult for them to retain themselves in care. So through that strategy, we're hoping that by working really closely with a case manager, we can help support individuals who need that extra help to stay in care. Medical transportation. So EHE medical transportation is a little bit different than the traditional medical transportation that might be available to clients, in that we're actually utilizing services like Lyft, which is a little bit different, and really kind of trying to provide someone with red carpet treatment to their medical appointments. We're also implementing a rapid start of ART, so ART being antiretroviral therapy. So there are some studies that show that the quicker someone gets into care and starts taking their medication, it really helps promote self-efficacy and helps them to really take control and be in charge of their health status. We're also implementing a community health worker program. The state of Ohio does have a credential for community health workers through the Ohio State of Nursing Board. And so individuals, we are actually on our second cohort of this project. We're currently recruiting candidates for our second cohort, in which they will receive education and training and community service hours towards receiving that community health worker certification. And then we're going to be utilizing these individuals who have this credential to serve in a peer navigation role within the hospital settings. Again, just kind of having that support and those wraparound services for someone with HIV who may be struggling to retain in the care. We're also doing a social media campaign. We have developed a website called loveleadshere.org. And I will be sharing a little bit more here about that in the next slide. So this is just some examples of the social media campaign. One focuses specifically on PrEP, and the other one focuses on the messaging around U equals U, which I mentioned earlier. So right now, this website has actually reached over 300,000 visitors. So we're hoping that by using kind of these non-traditional strategies, that we'll be able to reach a wider audience and make sure that HIV is really kind of staying on people's minds and radars. It's something that we now have the ability to prevent. And so we don't have to settle for new HIV transmission. And so we're really trying to help promote this. And if you visit this website, there's actually a social media handbook guide where it has different posts that you can share online, as well as the images that are free to download. You can print them, there's posters. We also recently translated this campaign into Spanish. So of course, if you have any questions, feel free to reach out, but all those materials are free to use, and we encourage you to do so within your own organization's social media campaigns or your own personal ones. So what I'd like to end with is just some food for thought. So we can't do this alone. The health department really needs this to be a community effort, or we're probably not going to be successful. And so I would just ask that you consider what role you might play as a care provider in ending the HIV epidemic. Are you ensuring that you're taking sexual histories of your clients? Are you offering an HIV test? Does your organization have the ability to get someone into care if they need to be if they do come back with the HIV positive diagnosis? So I would leave you with that, and I thank you so much, and I look forward to your questions.